So in particular, in my session, it was a very diverse, I would say, session, which is always interesting. Some people were more biochemists, and they were looking at aggregation of different amyloid or tau species. So that was great because, in particular, with the amyloid species, for example, the importance of the 4-42 peptides was brought up, how they aggregate in the brain. And it was also interesting that not always what we used in our research, the fibrils that we use in our research are the same that are found in the brains. So we have to improve basically the ways to make them as similar as possible to have a more effective research, because of course you can take them from the brain and treat cells or animals, but it's harder because you have only a limited amount of Alzheimer's brain to take from. So that's something for the community to think about. And there were also interesting talks, Dr. Gold and Dr. Vassar on, Dr. Gold in particular talked about different proteins that are present in the plaques and how really not only amyloid can be the important factor in how the Alzheimer's pathology develops, but also what other proteins are together with amyloid in the plaques. And Dr. Vassar's talk was also very interesting for me because it was related to therapy and drugs that are also known to decrease blood pressure, which is very similar to what the carbonic anhydrase inhibitors do. So there are commonalities there, and that we really need to think about what we can do to basically reduce cardiovascular risk factors because they affect the cerebral vasculature in the brain, and of course neuronal cells as they were showing. And there are many other interesting talks in ADPD. Overall, I like the conference a lot because there is a good mix of basic science and clinical, but I always like to go, even better in person. But Donna Wilcox's talk was also really interesting. They are looking at biomarkers of microvascular dysfunction in humans. So in relation to white matter disorder, and there are some newcomers. So it would be interesting to study the effect of those in our pathways as well.